So thanks everyone for taking the time to join at short notice to discuss the ongoing management of EM. Can we start with a round of introductions, please? I'll start. I'm Dr. Natasha Sovan, Paediatrics, and I'm EM's named consultant.
Hi, I'm Simon Chapman. I'm the nurse manager, ward manager for Paddington Bear Ward.
Hello, I'm Dr. Rory Conn. I'm a consultant psychiatrist. Thanks for inviting me to join.
Hi everyone, I'm Sarah, the dietitian for Paddington Bear Ward.
Thank you all for joining. And just to say that this is a professionals meeting, so I will be documenting all of this in the notes afterwards, and we'll plan to feed back the outcome to the family. They're aware that this meeting has been scheduled. So if I give you a brief summary of the patient, EM is a 14-and-a-half-year-old. She has a diagnosis of atypical anorexia nervosa, depression and anxiety, and this is the third day of her admission. She was initially referred to CAMS 9 months ago with self-harm and anxiety, which improved with outpatient support from the team. About 3 months ago, though, they noticed that she was voicing distress about her weight and shape, was skipping meals, and her family reported that she'd become less flexible and more controlling around food. She was referred to the eating disorders team, who saw her quickly because by this time she was losing weight at around ½ a kilo a week. After a brief improvement, the weight loss continued, and over the last 5 weeks, she's lost 8 kilos. Pre-morbidly, her weight was 66 kilos, so percentage mean BMI was 115%, BMI was 23 kilos per metre squared, and her current weight is 52 kilos, so 92%. So in total, she's lost 14 kilos in the last 3 months, and 8 kilos of this, 60%, has been in the last 5 weeks. She was admitted to PEDS as a referral from the eating disorders team for medical stabilisation 3 days ago, as she's only drunk water for the 4 days, and she's been voicing that she would rather die than eat. She's not really felt able to talk to any of us at all since admission. She presents really low in mood. Her obs at admission were blood pressure 85/60, her pulse was 39, but this is dropping to 29 overnight. Core temperature was 35.7 degrees, and she hasn't got a postural drop. Nothing's changed much over the weekend. Her admission bloods have been unremarkable, but ECG this morning shows a QTc of 0.47 milliseconds. Can we just get a brief nursing update, please?
Sure. From a nursing point of view, the weekend team have found it really difficult to manage her. They've prescribed the meal plan, but it's not been touched all weekend in spite of having one-to-one support. Plus, she's pulled her cannula out twice now, so she's not actually getting any fluids at all, apart from the small amounts that she's drinking. 2 senior doctors spent quite a long time with her, both yesterday and today. So that's over the weekend, and this morning yourself, Dr. Sovan. And neither have persuaded her to accept a nasogastric tube. So I have to say, though, the family are very supportive. But as it stands, hasn't really got any access. She's refusing all medications and all food, but is drinking a small amount.
But I've been asked to join because there's a question about a tier 4 bed and whether she should be managed in a psychiatric setting. The first thing I want to say, that seems like quite a step at this stage. It's in her best interest, clearly, that we manage things locally, as we're the team that know her. You're getting to know her. And we know, of course, that national waits for specialist eating disorder beds, sadly, at the minute, are several months anyway. But I'm also clear from what I've heard that she'd be too physically unwell to transfer anyway at the minute. Tier 4 bed wouldn't accept her. Can I understand how things are this morning in the last couple of hours, and what supports are available on the ward to her?
So she's been pusing consistently over the weekend. EM is currently in the bay, so she's near the nursing station. She's on one-to-one. Both parents look exhausted. They have a 7-year-old at home, so it's mostly EM's mother who stays.
So you're quite concerned about her physical health at the moment, that's clear, and I'm sure her parents are as well. What does EM herself understand? What's been said to her about what's going on?
So she hasn't really talked to us at all. It's her mother that does most of the talking most of the time. She's been there for all the conversations.
And I'm pretty much getting the same. She hasn't volunteered any information we could use to change things. She's been told we're worried about her safety. She's been offered an NG tube to take the pressure off, and she knows that she could have 40-sip instead. She also knows that we wouldn't allow her to come to any harm.
That's good she knows that. I wonder if she could be given some written information, though. Perhaps with her starvation, she's not taking things in fully. And if she could have some written information to explain the dangerous physical situation she's in, and the proposed course of action if we're talking about nasogastric tubes, including her seeing a tube and having explained what this would involve. And ideally, I'd also like her to be asked, if she's unable to speak, to complete some screening tools for us, like the RCADS, which is a measure of depression and anxiety. And this would be really helpful in establishing if there's any evidence of mental illness, and to what degree that is, in addition to what we already know. And I'll come and see her later this morning.
So thanks for joining again. So since yesterday, repeated conversations when we last met, EM has shown that she's either unable or unwilling to have a meaningful discussion with us about what happens next. I think she lacks insight to make decisions about her well-being.
We really need to treat her, because this is really getting quite worrying now. Can't we just like use the Mental Capacity Act or something?
I don't think so, because she's not 16 yet, so I don't think we can apply the Mental Capacity Act, but I'm fairly sure we can think about treating her under the Children's Act.
That's right, I'd agree. The critical thing for the minute is that we act in her best interests and also in the least restrictive manner, but she needs treatment.
Okay, well, I'm happy that we will have to give her an NG feed to protect her physical state and to physically stabilise her. But I think the nurses are going to feel uncomfortable with holding her. How much is she resisting?
Right now, she's in the treatment room. She's holding her fingers over her nose and face and pushing people away with her other hand.
So what are we able to do from here?
I'm afraid the nurses just aren't trained in this sort of thing. We can't do restraining.
I know it's far from ideal, but the only people who are in the hospital are the security team who are trained in safely restraining her. I think it's the safest way to do it.
Well, we've spoken with the parents and I've recorded their wish for her to be treated as needed. Whatever it takes is what they told me.
And as she's in a life-threatening situation, potentially, we should record in the notes we're using common law in a proportionate way. If we need to, for example, hold her arms by her side or hold her head steady, that can be done.
And so my understanding is we should only do this for the shortest period of time. So I don't think we should use this ward feed pumps, but what we can do is get the feed ready to go in syringes and push it through as quickly as possible. Would that be all right?
Yeah, that sounds a great idea.
Don't we need to wait until CAMS have assessed her and put her under a Mental Health Act section or something?
No, that would cause an unnecessary delay. I have met with her briefly and discussed with my colleagues, but the treatment required now is treatment for her physical state rather than specifically a treatment for mental illness. Although in anorexia there is overlap and nutrition is key for both, but it may take some hours for us to convene a Mental Health Act assessment.
Okay, so let's really be clear with the patient and the family then. Let's kind of set allocated time, get everybody ready, start allocating roles and jobs so that everybody knows what they're doing.
And we could maybe think about speaking with the play therapists, because they might be able to discuss some distraction techniques, which might be helpful.
Absolutely. As long as the patient's clearly told what's happening, who everyone is and what they can expect. This is going to be really traumatic for everyone, not just for EM, but for all of us. So it's really important that it feels like it's controlled as much as possible under the circumstances.
And I'll talk to her first again about whether a small dose of an anxiolytic medication might help her. It often takes about 20 minutes to work. She might even accept the tube without holding if we do this. And
after we've completed the feed, let's all come back here and debrief. Plus we can decide who's going to complete the datix.
Well, it sounds as if we've got a plan. Does anyone have any questions?
So thanks everyone for coming back. So just to give a summary of the last 2 days, in practice, whilst we've had to use some restrictive practice initially, She is now accepting the feeds and no restraint has been used in the last 24 hours.
Yeah, it was really good. I met with EM and Mum this morning, and she agreed to try and drink the 40 sips rather than having them down the NG tube. So let's give this a go and see how she does.
That's great. Dr. Con has also now met with, so the psychiatrist has met with EM and her mother a few times. He feels much more confident that she's engaging and understands what's happened. She seems to have more insight than before and is engaging more by accepting 40-sip drinks. He's confident, and I'm much more confident that this is without coercion. I have spoken, or sorry, Dr. Con's spoken to the hospital legal team, and we've also been liaising at the AMP, and everyone feels that there's no need to escalate at the moment. He also feels if things were to go back to where they were, then this would be unavoidable, and then we'd have to reconvene and consider detention under the Mental Health Act.
Okay, so I've got a couple of plans in place. I've got the NG plan and a plan for her to be able to drink it, and also hopefully soon we'll be able to move towards a normal meal plan as well.
And the family, to be fair, sound much happier now. They seem relieved.
That's great, everyone. Thank you so much for all your help and support with EM.